Hello everyone. So in this session we are going to cover up a very important topic of neuroanatomy, that is ventricles of brain and the CSF circulation. So in the brain we have got the two lateral ventricles and we have got one fourth ventricle and one third ventricle. So these are the ventricles which is communicating with each other, and then we will talk about the CSF circulation. So let's start with the topic. So here this is a schematic diagram to help you to understand the location of the ventricles and the communications of the ventricles. So in red color we can see the lateral ventricle. So this is the lateral ventricle. Okay. This is the lateral ventricle. Now what we can see that the lateral ventricle is communicating via foramen of Monro with that of the third ventricle. So this is the third ventricle shown in blue color, and the communication of both the lateral and the third ventricle is via foramen of Monro, which is called as interventricular foramen of Monro. Now if we'll see the communication of third and the fourth ventricle, it is occurring via cerebral aqueduct. So this is the cerebral aqueduct, and here it is communicating with the fourth ventricle. So we can clearly see the ventricular system of brain, and we can see the communications of the ventricular system of brain. So here we can see the CSF, which is maximum amount of CSF is produced by the choroid plexus of lateral ventricle. From there it traverses via foramen of Monro, interventricular foramen of Monro, into third ventricle, and from third ventricle it will pass through the cerebral aqueduct of Sylvius to fourth ventricle. So these are the ventricles which we have to study. Now the first ventricle which I want everybody to understand is the fourth ventricle. It's a very important ventricle. Why? Because it is surrounded by the vital structures. Okay. So here this is a section of the brain in which you can see, if I just enlarge this, I just want to highlight this. So here this will be so in green color I am highlighting this. Can you see this? This is triangular in outline. So can you see this triangular outline which I am highlighting? This triangular outline is the fourth ventricle. Which ventricle is this? This is the fourth ventricle. Let me just write it. This triangular outline is the fourth ventricle. Now, if you will see the fourth ventricle, you can see it is lying anterior to the cerebellum. So, this structure which you are seeing, I am writing C for the cerebellum. And here, if we see the anterior aspect of the fourth ventricle, in the anterior aspect of fourth ventricle, we have got the pons, the lower part of the pons, and the upper part of the medulla. So, here you can see on the anterior aspect, there is pons and the medulla, and exactly posterior to pons and medulla and anterior to cerebellum, the triangular green color outline which you are seeing is the fourth ventricle. So everybody should know about this. Now, so exactly it is very important to know the anatomy of the fourth ventricle because many important structures are residing there. So let's start important features of the fourth ventricle. So it's a it's a tent-like cavity. It was triangular in outline. You can say it is tent-like cavity which is exactly lined up by ependyma and is filled with CSF. It is situated in front of cerebellum and behind the upper part of the medulla and the pons. So please write down the location. So it's a tent-like cavity of hindbrain. It's a tent-like cavity of hindbrain lined with ependyma. It is lined by ependyma and filled with CSF. So it is filled with CSF and it is lined by ependyma. It is situated in the posterior cranial fossa. It is situated in the PCF. What is PCF? PCF is the posterior cranial fossa. So it is situated in the posterior cranial fossa in front of cerebellum. And behind pons and medulla oblongata. Behind pons and upper part of medulla oblongata. Upper part of the medulla oblongata. Now, if we will see, it is inferiorly continuing with the center. So exactly, it is continuing inferiorly with the central canal of the medulla oblongata, and superiorly it is communicating with cerebral aqueduct of midbrain. So the fourth ventricle, if we talk about the communication, so if we are talking about the communications of the fourth ventricle, so inferiorly it is continuing with the central canal. It is continuing with the central canal of the medulla oblongata, continuing with the spinal cord, you can say, and superiorly it communicates with cerebral aqueduct of midbrain. So done with this. Now it's important to know the features of fourth ventricle. So if it's important to know the boundaries, the roof and the floor of fourth ventricle. So one by one I am going into the details of each of the ventricle. Firstly I will describe the fourth ventricle, then the lateral ventricle and then the third ventricle. So features of the fourth ventricle. So let's talk about the features. So let's talk about the features of fourth ventricle. So अगर features of fourth ventricle की बात करें तो it is having number of important features and recesses. So it's we have to talk about the angles, we have to talk about the recesses, we have to talk about the boundaries, we have to talk about the roof, we have to talk about the floor. So अगर recesses की बात करें, so that is 5 in number. That is 5 in number. And exactly that recesses are extensions from the cavity of fourth ventricle. What is this? These are extensions from the cavity of fourth ventricle. From the cavity of fourth ventricle. Now, exactly there are two recesses. So one by one I would like to write the recesses. There are two recesses and again there are also median recesses. So there will be a median dorsal recesses and there will be two lateral dorsal recesses. So one by one we will talk about each recesses. The first one is there are total 5. So there are two lateral recesses. So there are two lateral recesses. The first is there are two lateral recesses. If I talk about the two lateral recesses, actually one on each side and it is extending laterally in an interval. So exactly अगर extend की बात करें तो two lateral recesses is lying one on each side and it is extending laterally between the inferior cerebral peduncle ventrally and that of flocculus dorsally. So exactly what is the location of the two lateral recesses in context of fourth ventricle? It is exactly lying between the two important structure. Ventrally there lies inferior cerebral peduncle and dorsally lies the flocculus. So we have done with this. So यहाँ पे total कितने हो गए? 2. What is remaining? A total of 5 is there. Then we have got 3 more. So we have got following. We have got a 1. The next is we have got one median dorsal recesses. One median dorsal recesses is there. So we have got one median dorsal recesses. Exactly if I talk about median dorsal recesses, it is extending in the white core of the cerebellum and the location of median dorsal recesses is just cranial to the nodule part of the cerebellum. So now talking about the other one, we have got two lateral recesses also. We have got two lateral recesses, so exactly two lateral dorsal recesses. Two lateral. So अगर two lateral dorsal recesses की बात करें तो one on each side it is lying. So exactly there is one median dorsal recesses on either side of one median dorsal recesses. There are two lateral dorsal recesses. So total कितने recesses हो गए? 5. There is two lateral recesses, there is two dorsolateral recesses and there is one dorsomedian recesses. Okay. So done with this. Now we will talk about the boundaries. Now let's talk about the boundaries of the fourth ventricle. So important boundaries of the fourth ventricle is that on laterally, so we will talk about also the roof and the floor, but firstly we should know what are the structures which is bounding it infralaterally and supralaterally. So infralaterally, if I talk about the boundaries, it is bounded by ICP. What is ICP? Inferior cerebellar peduncle. What is the full form of ICP? Inferior cerebral peduncle. It is the fibers which is connecting the medulla with the cerebellum, and it is supplemented infralaterally, not only ICP, it is also supplemented by gracile and the cuneate tubercle. So it is supplemented by gracile and cuneate tubercle. Now supralaterally. Now talking about supralaterally. So if I talk about supralateral aspect, the supralaterally, it is bounded by superior cerebellar peduncle. So it is bounded by SCP. What is SCP? Superior cerebellar peduncles. Now the next important point is to know about the roof, which is also called as the posterior wall of the fourth ventricle. So exactly, I just want to show you the image of the sagittal section once again. So if you just enlarge this, so all of you just focus on this image. Okay. So when I'm showing you, I'm just using another color so that you can see here. So this is exactly the outline, the green color which has got a pink outline, that is the fourth ventricle. So exactly, अगर हम इसके floor और roof की बात करें, so here we have got this sloping part which you are seeing. So this sloping part which has got an apex which is going inside the core of white matter, this is exactly the roof which will have two parts, upper and the lower, and this part which you are seeing is the floor. This part which you are seeing is the floor. So that means अगर फ्लोर की बात करें तो फ्लोर इज फॉर्म्ड बाय द pons and medulla oblongata. Clearly it is clear that the floor will be formed by the pons and medulla oblongata, but the roof is formed by a sloping surface. There will be an upper and the lower sloping surface. So this is how we have to understand. And the next thing is that after that we have to know about the roof and the important structures of the roof. So अगर हम roof की बात करते हैं, so please write down. Roof, which is also called as the posterior wall. Roof is also called as the posterior wall. So roof is also called as the posterior wall of fourth ventricle. और अगर हम इसे sagittal section में just we have visualized, it's a tent-like structure and it has got an upper and the lower sloping surface, and its apex is exactly traversing, going inside the white core of the cerebellum. That means the roof of the or the floor, roof or the posterior wall of the fourth ventricle will have an upper sloping surface, and will have a lower sloping surface, and both of it will join to form the apex, and the apex of this tent-like structure will be protruding inside the white core of the cerebellum. So done. Now here exactly a schematic diagram and another diagram is there so that you can understand the roof of fourth ventricle. So let me slightly enlarge it. So here this diagram is for the roof of fourth ventricle, and in this image you can clearly see that there are two parts in the roof. The upper part is formed by the superior medullary velum. So exactly the upper part of the roof which is formed is between the superior cerebral peduncle, and it is called a superior medullary velum. Upper part of the roof is formed by the convergence of the two cerebral peduncle, and it is covered by thin sheet of white matter which is called the superior medullary velum, and that is triangular in outline. So this is superior medullary velum. So if you want, you can write here itself. Upper, if we are talking about superior medullary velum, it forms the upper part of roof. And exactly this is forming the upper part of the roof which is lying in between the convergence of two superior cerebral peduncles. And exactly now let's talk about the inferior part. If you will see the inferior part, it is lying between the inferior cerebral peduncles, as you can see in this diagram. And exactly agar hum superior, if we are talking about the superior medullary velum, it lies exactly, there are two superior cerebral peduncles on either side which has been shown. So here you can see these are the two superior cerebral peduncles which is shown on the either side, and exactly on its side it is exactly correlated. The superior cerebral peduncle is related with the lingula part of the superior vermis of the cerebellum. The lower part of if we talk about the lower part, so the upper part is made of nervous tissues. It is made of nervous tissues. I'm just enlarging it. Yeah. And if I talk about the inferior and the lower part, if I'm talking about the inferior or the lower part, which has been shown in the violet color, it is formed by inferior medullary velum, which is conjointly actually formed by the ventricular ependyma and pia mater. So, so it is the tila choroida. Here we have got a double layer. So you can just see here, the lower part is having tila choroida, that is the double layer of the pia mater, and also you can see the red color choroid plexus which is in the form of T-shaped, and there are two foramen. So exactly agar aap dekho to there is a lateral foramen that is called as foramen of Luschka, and inferiorly there is one large foramen of mesendi. Actually these two structures which you are seeing, that is laterally the foramen of Luschka and that of the foramen of mesendi, it forms a communication of for the flow of CSF from the ventricular system of the brain to the subarachnoid spaces. Okay, so we will just write these important points about the roof. So already talked about the superior medullary velum. Now you can just write about the lower part. The lower part of roof. The lower part of roof is formed by thin sheet of non-nervous tissue the inferior medullary velum, which is called as the inferior medullary velum. Okay, and if I talk about inferior medullary velum, actually अगर हम superior aspect की बात करते हैं, that is the superior medullary velum which is a nervous tissue. अगर हम inferior की बात करते हैं, inferior medullary velum, it is a non-nervous tissue but it is formed conjointly by, so it is formed conjointly by two structures. One is ventricular ependyma. Ependyma is having ciliated columnar epithelium, and by double layer of pia mater. It is having a pia mater which is actually forming tila choroida. Now, it is exactly also important for us to know that it is intimately related with the nodule part of the inferior vermis of the cerebellum. Now, lower part, if I see the lower part, if I am talking about the lower part of inferior medullary velum, in the lower part there is an aperture. So, there is aperture in the lower part. There is one large aperture in median plane. And this large aperture in the medial plane is called as foramen of mesendi. What is it called as? It is called as foramen of mesendi. It is called as foramen of mesendi. And through the foramen of mesendi, the communication between the fourth ventricle and the subarachnoid space takes place. So, it is very important. So, you can just write, actually two communications are there, and we have already seen the lateral communication in this image. The lateral communication was via foramen of Luschka. So, there was a lateral communication. So, laterally the communication is via the foramen of Luschka as shown in this image. This is forming lateral communication, and the other communication is foramen of mesendi. So, you can just write down through foramen of mesendi, the cavity of The cavity of fourth ventricle communicates with subarachnoid space, with the subarachnoid space, and with subarachnoid space it is communicating with the cerebromedullary cistern, which is also called as cisterna magna. It is communicating with cerebellomedullary cistern, which is also termed as cisterna magna. Is also termed as cisterna magna. Okay. Now, the tila choroida of fourth ventricle, actually, it's also important for us to know the tila choroida. So, when I am talking about the tila choroida, it is actually a double layered. So, it's a double layered fold of pia mater between the inferior vermis of the cerebellum. It is located between the inferior vermis of the cerebellum and the lower part of the roof of fourth ventricle. So, you can just write down, and it is containing here. Okay. The tila choroida of fourth ventricle. The tila choroida of fourth ventricle is actually a double layered fold of peritoneum, double layered fold of pia mater. Sorry, a double layered fold of pia mater. Slip of tongue, please. It is a double layered of pia mater and located between it is located between inferior vermis. So, it is located between inferior vermis of cerebellum and lower part of roof of fourth ventricle, the roof of fourth ventricle. So, done. So, this is exactly I just want here, you can see the red color structure which you are seeing here is the choroid plexus. So, what does it contain? So, you can just write down. Here itself you can point out. I just, in a point you can write this point. I just want to enlarge this. So, here I just want to enlarge it and write an important point here. So, please write down. So, exactly in this double layered pia mater tila choroida, what does it contains? It contains the choroid plexus. So, for this you have to know the choroid plexus. So, we have to know about the choroid plexus. So, write down the choroid plexus. Exactly, choroid plexus is the capillary network, and this is formed by the branches of posterior inferior. It's a choroid plexus is a capillary network, and here in this case it's formed by the branches of PICA. What is PICA? Posterior inferior cerebellar artery. It is formed by posterior inferior cerebellar artery. So, done with this. Now, I just want everybody to see this image where exactly this is the floor of fourth ventricle. So, this is exactly what? This is the floor of fourth ventricle. So, we will now talk. We have completed the roof. Now, I am talking about the floor of fourth ventricle. So, now we will come up the discussion with the floor of fourth ventricle. So, please write this floor of fourth ventricle. So, this is also an image showing floor of fourth ventricle. Now, floor of fourth ventricle is a very important structure, as so many times agar hum previous year of papers, of question papers, and we correlate with the MCQs of the NEET PG exam, INICT exams, what we can see that floor of fourth ventricle has been asked several times. So, floor of fourth ventricle is formed by the posterior surface of pons and that of the upper part of the medulla. So, upper part of the medulla, that is the posterior aspect of medulla. So, exactly agar ye diagram hum dekhte hain, so I am just enlarging this diagram. And here I just want everybody to concentrate on this image so that we can understand the important aspects. So, here there is the as I already told you, ye kaise form hota hai, what is the structure which is forming it. So, it is formed by the pons and the medulla. So, to be more specific, it is formed by the posterior surface of pons and the upper posterior aspect of the medulla. So, junction, if you will see, it is rhomboidal in shape. So, agar hum isko outline karte hain, so this is the rhomboidal shape structure. That means it is divided into upper and the lower triangular space. So, exactly in between the upper and the lower triangular space, there is structures traversing. So, there will be structures traversing in between, and this structure is called as stria medullaris. What is this? This structure which you are seeing is the stria medullaris. To be more specific, I should use different. Yeah. So I will use highlight. So here this is the structure which I have showing this is stria medullaris, and the stria medullaris is exactly at the junction. It is exactly at the junction of upper and the lower triangular space. So after that, it is divided into half. It is divided into equal half on either side, right and the left half. So in that case, there is a midline. So you can see a midline sulcus is there, which is called as median sulcus. So by median sulcus, it is divided into equal halves. Now, other than that, laterally there is another sulcus which is called as sulcus limitans. So you can use a different color. So yes, you can see their next sulcus is the sulcus limitans. So this is the lateral sulcus which I am highlighting in red color. This is sulcus limitans. This is what sulcus limitans. Now, other than that, if you will see the sulcus limitans superiorly it is. So this is sulcus limitans, but if you will see the sulcus limitans, it is superiorly forming here. So we will use blue color for it. So superiorly it is having superior fovea, and inferiorly there is inferior fovea. Inferiorly there will be inferior fovea. Now superior fovea, if you will see the superior fovea, exactly above the superior fovea, you can see there will be discoloration. So there will be bluish discoloration, and this discoloration is called as locus coeruleus. This is called as locus coeruleus. Okay. Got it? So exactly, and the area which is lying on either side of median sulcus, that area is called as median eminences. So there are many structures lying in the median eminences. Okay, so let's write few important points. Again, we will come to this image. So please write down. Floor. So floor is formed by posterior surface of pons and upper part of medulla. Got it? Now, so exactly agar hum junction, its overall outline of the floor of fourth ventricle is rhomboidal shape, but if we are dividing into two triangular spaces, there will be an upper and the lower triangular space. At the junction of upper and lower triangular space, there will be fibers traversing, delicate bundles of fibers transversely running and traversing, that is called as stria medullaris. So overall shape is, it is also called as rhomboidal fossa, which will be diamond shape, but it is divided into upper and lower triangular area. So this upper and lower triangular area, in between the structures, in between transversely running delicate bundles, there will be running delicate bundles of arranged fibers which is running, and these are called as, what is this called as? This is called as stria medullaris. This is called as stria medullaris. Now, so now we have to know the features. As I already told you, it is divided into equal halves by median septum. So there is right and the left half. So there is division of right and left half, and this is done by median sulcus. And on either side of median sulcus, there is median eminences. What lies there? Median eminences. And laterally to the median eminences, the other sulcus is lying. That sulcus is called as sulcus limitans. What is it called as? This is called as sulcus limitans. Now, this sulcus limitans is diverging upper and lower to form superior and inferior fovea. So, if I talk about sulcus limitans, the sulcus limitans is exactly having a widened triangular area above, that is forming superior fovea. And just above the superior fovea, there is actually bluish gray area. So above it means above superior fovea. Above it lies locus coeruleus structure, and this is bluish gray in area. Why? Because it contains melanin pigment. Why? It is containing melanin pigment. And what is it secreting? Why it is appearing bluish gray in color? Because it is having substantia ferruginosa. So done with this. Now lower part में भी मैंने जैसे कि superior fovea है, same way अगर lower extension of the अगर हम lower extension of or the lower part of sulcus limitans देखते हैं तो lower down sulcus limitans lower down will form inferior fovea. Okay. Now, there are a few other most important structures which has been asked in the examination. So, you have to know actually on either side of the median, in the median eminences only there is an oval elevation and oval swelling is there. Exactly that oval swelling is in the pontine part of the floor, and this oval swelling is called as facial colliculus. Actually, this facial colliculus is formed by the fibers, by the motor fibers of the facial nerve winding around the abducens nerve nucleus. So, this is also very, very important for you. So, please just see the image once more. So, I am just enlarging this image. See here. So, here you can see facial colliculus. So, I will just use another color for facial colliculus. See here. So, this is the facial colliculus. This is the facial colliculus. So, ये facial colliculus है which has been highlighted in green color, and what you can see that facial colliculus is a rounded elevation. So, we are talking about this. This is the facial colliculus, and this is formed by the winding of motor fibers of facial nerve around the abducens nerve nucleus. This is called as internal genu of facial nerve. Now, and exactly from the as I told you, from the inferior fovea, you can see again from the inferior fovea, the sulcus limitans in the lower medullary part is also having two triangular areas. There is an hypoglossal triangular area and there is a vagal triangular area. So exactly vagal triangular, and lower down also there is an area which is called as area prostremia. So we have to know about all these structures. So please write down. Then we will come to the lateral vein. But before that, I just want to complete it. So write down the other structures. So on either side in median eminences, so lying in the median eminences only, but in the pontine part. But in which part? In the pontine part, in the pons, there is facial colliculus. There is which structure? Facial colliculus. So please note down, it is facial colliculus which is residing in the pons part, which is forming the upper part of the floor of fourth ventricle. The facial colliculus is formed by winding of motor fibers of facial nerve around abducens nerve nucleus. So it is called as internal genu of facial nerve. So why it is called as internal? This exactly facial nerve is not the content, but the motor fibers winding and forming an elevation, that is facial colliculus, is the content of the floor of fourth ventricle. Other contents you can just write down the name. I just want to enlarge this image, and you can just, yeah. So you just write down the names of important structures. So I will just explain just so the other structures. So what I told you, from the inferior fovea, what happens, the sulcus limitans will be obliquely going downwards and meeting with the median sulcus. So in the medulla. So exactly in which part? In the medulla part. In the medulla part of the floor of fourth ventricle, we have got another triangular area. So we have got a vagal triangular area and we have got a hypoglossal triangular area. So here, if I talk about the vagal triangular area, it is containing the nuclei of which nerve? It is containing the nuclei of 10th, 9th and the cranial part of accessory nerve. And the cranial part of accessory nerve. Cranial part of accessory means 11th nerve. Got it? और अगर हम hypoglossal की बात करें, so this was about the vagal triangle. So this was about which triangular space? This was about the vagal triangular space. Now if I am talking about the next triangular space, that is the hypoglossal triangular space. So अगर हम hypoglossal triangular space की बात करें, it is formed by the nucleus of 12th cranial nerve, that is hypoglossal nerve nucleus, which is exactly medially, and if we see in the hypoglossal triangular area laterally, we have got intercalatus nucleus. So all these contents you have to know. All these contents you have to know. And lower down also we can see the area prostremia, and also infralaterally if you will see the lower part. If you just see the lower part, this is joining in the lower aspect, and this is having a white fibers running, which is called as the which will have obex, which is called as obex. So if we see the overall structure of the floor of fourth ventricle and the shape protruding, that whole shape is like a like a pen, that is fountain pen nib or something. So the whole outline of the floor of fourth ventricle is represented as the pen nib, and it is called as calamitous scriptorius. What is it called as? It is called as calamitous scriptorius. So done with this. Now I would like to talk about the next ventricle, that is the lateral ventricle. The next ventricle, that is the lateral ventricle. So we have got two large lateral ventricles. That is actually, it is one for each of the cerebral hemisphere. Roughly it is C-shaped and it is lying below the corpus callosum. So you can just enlarge this image. So I'm just enlarging this. So if you enlarge it, so exactly, अगर हम enlarge करते हैं, so this is which fibers? This is the corpus callosum fibers, the white fibers, which is white commissural fibers, which is connecting the brain of both the side. This is the corpus callosum fibers of both the side, and in below this and in this cavity, what we can see in this cavity below it, we can see the lateral ventricular cavity. What we can see? We can see the lateral ventricular cavity. Okay. Now, one lateral ventricle for each side. Okay, so let's, this is exactly the location of lateral ventricle, and let's write more of detail of it. So let's proceed. So we have got lateral ventricle 2 in each. So we have got 2, that means 2 total, that is 1 for each cerebral hemisphere, roughly C-shaped. And exactly, it is also important that lateral ventricle will be wrapping around the thalamus and the hypothalamus. So lower to it, we can see this is the T for the thalamus, this structure is T for the thalamus, and we have got also HT for the hypothalamus. So exactly, this thalamus is there, hypothalamus is there, and also there is lentiform nucleus and caudate nucleus. So exactly, agar hum baat karte lateral ventricle, so its relation is that this lateral ventricular cavity is wrapping around these structures. So you can just write on this point, they are 2 in number, 1 for each cerebral hemisphere, roughly C-shaped, lying below the corpus callosum, and it wraps around, the lateral ventricle wraps around following important structures. So it is wrapping around the thalamus, it is wrapping around the lentiform nucleus. So it is lower down. So exactly, it is wrapping along. If I talk about thalamus and hypothalamus cavity, in between, that is the cavity of diencephalon and the ventricle related to the diencephalon, that is third ventricle. Here I am talking about the relation. So अगर हम lateral ventricle की relation की बात करते हैं, it is wrapping around the thalamus, lentiform nucleus and caudate nucleus. Caudate nucleus. Lower to it lies the hypothalamus. लेकिन thalamus, hypothalamus of both the side और उसके बीच में जो cavity रहती है, that is the cavity of the diencephalon, that cavity is the third ventricle. So that cavity will be the third ventricular cavity. Now here, exactly अगर हम lateral ventricle की बात करें, तो there are parts of the lateral ventricle and we have to know exactly what are the structures which and which are the structures which is related to it. So we have to one by one know about this. So let's talk about each side of the lateral ventricle is separated from each other by, lateral ventricle is separated from each other by septum pellucidum. By septum pellucidum. Okay, now parts of lateral ventricle. So we have to, so I think firstly I would like to show you this image so that you can understand. So here you can write down the parts of lateral ventricle. So I can just rub this and you have an idea of the parts of lateral ventricle, which is very, very important for you to understand the parts of lateral ventricle. Okay, so here you can write down the heading, parts of lateral ventricle. Parts of lateral ventricle. So here you can see this is the anterior horn which we are seeing. This is the body of lateral ventricle, the central part, which is also called as the central part. Then we have got the posterior horn and then we have got the inferior horn of the lateral ventricle. So kitne parts ho gaye? We have got the body of the lateral ventricle. So अगर body of lateral ventricle की बात करें, so it is exactly, here you can see this is interventricular. So here you can just see here, this is the interventricular foramen of Monro. Okay, so exactly body of the central part of lateral ventricle is extending in the parietal lobe, and it is extending from the interventricular foramen to that of the splenium of corpus callosum. What is splenium? The posterior part of corpus callosum is called splenium. So, and if we talk about the anterior horn, it is lying anterior to interventricular foramen, and it is located, it is exactly anterior horn extends from the central part, and it is exactly protruding in the frontal lobe. Posterior horn is also called as occipital horn because it is protruding in the occipital lobe. And if we see the inferior horn, it is the largest part of the lateral ventricle. Inferior horn is considered as the direct continuation of the main part of the lateral ventricular cavity, and it is related with temporal lobe. So it is related T for temporal lobe, posterior O for the occipital lobe, body or central part with the P for parietal lobe, and the anterior for A for the anterior lobe. So this is how the different parts of the lateral ventricle is divided. So exactly we have to know the parts. So here you can just write down parts of lateral ventricle. Parts of lateral ventricle. So अगर parts of lateral ventricle की बात करें तो we have to know the relations of individual part of lateral ventricle. So we have got 4 parts. We have got the central part, which is also called as the body. We have got the central part or anterior horn. We have got the posterior horn, which is called as the occipital horn. And we have got the temporal or the inferior horn. Got it? Now, अगर हम central part की बात करें तो it is lying within the parietal lobe. It is extending from interventricular foramen of Monro to the splenium of corpus callosum. Anterior horn की बात करें, it is an anterior extension from the central part of the lateral ventricle related with the frontal lobe of cerebral hemisphere and lies behind the genu of corpus callosum. Posterior horn is called as the occipital horn. It is a backward extension of the central part of the lateral ventricle towards the occipital pole. Inferior horn is the direct continuation and is the main and the largest horn, and it is extending in the temporal lobe. So now for understanding the relations of, so it is important that we should know about the relation of individual part of the lateral ventricle. So here it's also important that we should know the relations of individual part of the lateral ventricle. So I would like firstly to talk about so exactly the relations of lateral ventricle can be appreciated by the coronal sections of the brain. So when we take the coronal sections of the brain, we can appreciate the relations of different horn or parts of the lateral ventricle. So one by one, I am going into the details of it. The first part is the central part. So firstly, we will talk about the central part. We will talk about the central part or the body of lateral ventricle. So अगर central part or body of lateral ventricle की बात करते हैं तो it is having a roof, it is having a floor and it is having the medial part. So अगर roof की बात करते हैं तो roof is formed by, roof is related to or it is lying under surface of the trunk of corpus callosum or the body of corpus callosum, the largest commissural fibers of the brain. ठीक है? So here I just want you to show, actually this is a coronal section, schematic diagram showing the coronal section to understand the relations of the central part of lateral ventricle. So here you can see superiorly, this is the corpus callosum which I am talking. This is exactly the corpus callosum. So this is exactly the corpus callosum. This is forming the roof. Got it? And if I am talking about the floor is, these all structures will form the floor. And in the floor from above to downward, it is related with the following structures. This is the caudate nucleus. This is the caudate nucleus body. This is the striate terminalis, the thymostriate vein, the thalamus, the choroid plexus, and also the body of fornix. So these all structures are forming the floor. And medially, the medial structure and the structure which is lying medially will be the septum pellucidum. So this will be forming the medial boundary. So let's write it. Then so please write down. So here you can write down. This is about the roof. Medially, The relations of the central part of the body of lateral ventricle is, it is having relation with septum pellucidum. And what is important is to know the floor of the lateral ventricle, the central part. So write down. So we will talk about the floor. So please write down. Floor of central part of LV means lateral ventricle, and the structures related in the floor as you proceed from above to down. So as you proceed from, in the bracket you can write, as you proceed from above to down. So it is related to following structures. It is related to body of caudate nucleus. It is related to stria terminalis. It is related to thalamostriate vein. It is also related with the lateral part of the thalamus. And it is related with the choroid plexus. And also related with that of the body of fornix. Also related with the body of fornix. Also related with the body of fornix. So yes, done with this. Now, so we have done with the central part. Now the next part relation in lateral ventricle is the anterior extension of lateral ventricle, called as anterior. So again, another schematic diagram, coronal section. So here the cavity which is shown, this is the cavity of anterior horn. So here you can see superiorly, again the relation will be the body of corpus callosum. Actually we know that corpus callosum, agar hum corpus callosum ki baat karte, so it is a largest commensural fibers and it is having 4 parts. It is having a bend is there. This is rostrum, this will be genu, the body, and posteriorly the splenium. So anterior to posterior the structures will be, so it is slightly beak-like protrusion is there in the corpus callosum, which is the rostrum. Then anteriorly it is having the part genu, the main part is the trunk or body, and posteriorly there is splenium. So yahan pe septum pellucidum will forming the medial relation, corpus callosum body will form the superior relation, rostrum of corpus callosum will be related in forming the floor, the genu of corpus callosum will be in anterior relation, and exactly agar lateral wall ki baat kare to laterally it is related to the head of caudate nucleus. So please write down this relation. So you can write relations of anterior horn of LV means lateral ventricle. Okay. So here exactly the outline is triangular in coronal section and it is related roof. Roof is formed by body of corpus callosum. Floor is formed by rostrum of corpus callosum. Anterior wall is formed by genu of corpus callosum. Anterior wall, got it. And medially there will be, if I talk about medial relation, medially there will be septum pellucidum. There will be septum pellucidum. And if I talk about the lateral wall or the lateral wall, it is laterally related with the head of caudate nucleus. So done. Now let's talk about the next part, that is the posterior or the occipital part or horn of the lateral ventricle relation. So here again a schematic diagram, coronal section, where we can see it is somewhat, you can see this is the outline, this is the cavity of posterior horn, which is somewhat diamond quadrangular type of shape. So here if we will see, we have got following relation. So we have got the lateral wall. So you can see this is the lateral, there will be a roof. So roof, lateral wall, and also the important structures which is seen. So exactly it is having many important structures are there. So exactly अगर हम बात करें तो यहाँ पे इंपॉर्टेंट स्ट्रक्चर, सो हियर यू कैन सी, अगर हम रूफ, लेटरल और अपर एस्पेक्ट में देखें तो वी हैव गॉट ए टेपिक्टम फाइबर्स, वी हैव गॉट ए टेपिक्टम फाइबर्स. व्हाट इज टेपिक्टम फाइबर्स? टेपिक्टम फाइबर्स आर द white fibers of commensural fibers are derived from the corpus callosum splenial part, which is separating it from the optic radius, which is separating the cavity of the posterior horn with optic radiation. And अगर हम medially aspect की बात करें तो there are two ridges. One is the bulb of posterior horn, which is formed by the fibers of forceps major, and the other is calcar avis, which is formed from the calcarine sulcus, which is formed from the indentation of calcarine sulcus. So calcarine sulcus is a deep or a complete sulcus. So write down relations of posterior horn of corpus callosum, relations of posterior horn of lateral ventricle. ठीक है, relations of posterior horn of lateral ventricle. So अगर relations of the posterior horn of lateral ventricle की बात करें तो outline में it is roughly quadrangular, but if we talk about the structure, so the roof, the lateral wall, the floor, all these structures is having the relation with the tapetum fibers. Tapetum fibers. What is tapetum fibers? Which is arising from the splenium part of corpus callosum and separating the cavity of posterior horn of lateral ventricle from optic radiation. और अगर हम medial wall की बात करें, और the medial wall of the posterior horn is having two elevations, or you can say two ridges are there. Two ridges are there. The one upper one is called as the bulb of posterior horn. The bulb of upper is called as bulb of posterior horn, which is formed by which indentation? Forceps major. And the lower indentation, so this is the first indentation, and the lower indentation is actually calcar avis, and this is formed by calcarine sulcus. This is formed by the calcarine sulcus. Anterior part of calcarine sulcus. So done with this. Now we are left with the last part, that is the inferior horn or the temporal part of the lateral ventricle. So here if you will see, again we can see in this case the inferior horn, it is actually the place where the posterior inferior horn is diverging from each other. That area is termed as trigone. That area is termed as collateral trigone, and it will have roof and the floor. So यहाँ पे जब हम roof देखते हैं तो roof is related with the tapetum fibers, and it is also related with the tail of caudate nucleus. Floor देखेंगे तो floor में if I talk about the floor, so exactly in the floor we have got the hippocampus relation, the fimbriae is there, and also there is a collateral sulcus which is formed by the collateral sulcus which is forming collateral eminences. So this is very important, and also you can see the part of choroid plexus related. So please write down relations of inferior horn of lateral ventricle. Relations of inferior horn of lateral ventricle. ठीक है. Now the important structures related, so you can just write down. Roof is formed by tapetum part of corpus callosum, CC for corpus callosum, okay, in the medial part. So C from the corpus callosum, it is related with following structures. It is related with the tail of caudate nucleus, and it is also related with stria terminalis. Now अगर हम floor की बात करें तो floor is showing some indentations, and that indentations are collateral eminences is there. The collateral eminences is formed by collateral sulcus, then other than that we have got also relation with the hippocampus, Actually, fibers of hippocampus, that is a sheet of white fibers which medially converge and form alveus and converge medially to form also the fimbriae. These all structures are related and the structures seen in the floor of inferior horn of lateral ventricle. So we have done with this, and before ending I would also like to talk about the choroid plexus. So I would like to talk about the choroid plexus of the lateral ventricle, which is important for you to understand. Then we will proceed. So I just want, please write down about the choroid plexus of lateral ventricle. So अगर हम देखें most medial the floor is occupied by choroid plexus, and the choroid plexus of the lateral ventricle is derived from two sources. So it is formed from the two sources. It is formed by the branches, capillary branches of anterior choroidal artery. और यहाँ पे anterior choroidal artery is a branch of ICA, internal carotid artery. Also from the branch of posterior choroidal artery, and we know that posterior choroidal artery is a branch of posterior cerebral artery. Is the branch of PCA, that is posterior cerebral artery. Done. Now the last ventricle. So we have finished the lateral, two lateral ventricles, and the one is the fourth ventricle, and now we'll talk about the lateral ventricle. So lateral ventricle is the cavity of diencephalon. So it's a cavity which is lying between the thalamus and the hypothalamus. So it's a slit-like cavity. So in this coronal section, if I just enlarge it, can you appreciate the slit-like cavity? This slit-like cavity which you are seeing is the third ventricle, which is exactly here you can see these are the thalamus which has been shown. So here, and these are the parts of hypothalamus is also there. So this is exactly hypothalamus. So basically it is exactly a cavity of the, it's a cavity of diencephalon, and it is lying between the thalamus and hypothalamus. So third ventricle, here you can write down, it is a cavity of diencephalon. The outline of the third ventricle is very irregular. So if we see the outline, it is very irregular, and so it is having recesses and diverticulars. Now what is very important for us to know is the relation. So exactly boundaries and the relation. So let's talk about the boundaries and relations. So for that there is one image which will help you to understand. So here in this diagram, if I just enlarge this diagram, you can see very nicely. यहाँ पे जो ये cavity आपको दिख रही है, this is the cavity which I am talking. So you can see this whole outline is very irregular. So this is the third ventricle. So what is it? This is the third ventricle. So this is exactly the third ventricular cavity, and this is exactly irregular. Okay. Now third ventricle, you can write down the boundaries. We are talking about the boundaries. Okay. So anterior wall. So one by one I will explain all the relations. So अगर हम anterior wall की बात करते हैं, the anterior wall is formed from following structures as you see from above to down. Above to down, and the structures are anterior column of fornix, and the structures are anterior column of fornix. Then we have got anterior commissure. Then we have got lamina terminalis. Okay. These are the structures in the anterior wall. Let me show you. So actually this is an outline for understanding. So here you can see this is in the sagittal section, the outline of the third ventricle, where we will understand the relation. So exactly recesses and relations can be understood. So अगर हम A लिखते हैं, this is the anterior relations which is formed by anterior commissure, lamina terminalis, as you can see here, and also the anterior part of the fornix. Posteriorly there is pineal gland. There is pineal gland, there is also posterior commissure and also the cerebral aqueduct commencement is there. Floor में बहुत सारे structures होते हैं और we have got optic chiasma, infundibulum, we have got the mammillary body, we have got posterior perforated substance, we have got tegmentum of the midvein. These are all floor. Above you can see in the roof we have got tila choroida of the third ventricle. On either side laterally, what you understand by HS? What do you understand by HS? So HS का मतलब हुआ hypothalamic sulcus. So on either side laterally we have thalamus and hypothalamus. So exactly in this image also you can see there is 1, 2, 3, 4, 5. So what you can see there is 1, 2, 3, 4, 5. So अगर हम 1, 2, 3, 4, 5 की बात करें तो they are recesses. So we have got many recesses and diverticulars in relation to the third ventricle because third ventricle overall outline is very irregular. So please write down the relation. So already written about the anterior wall relation. Let's write the further relations. So anterior लिख लिया. Now write down posterior wall. Posterior wall of the third ventricle is related with the following structures from above to down. And the structures related is pineal gland. The structures related is pineal gland, posterior commissure, commencement of cerebral aqueduct. Okay. Other relations. So if I talk about the roof is formed by ependyma stretching across upper limit of two side thalamus. So it is stretching through the upper limit of two side thalami. Now, and if I talk about the floor has got many important structures related as you proceed from before to backward or so you proceed from before to back. And the structures are, please write down, the structures are optic chiasma, tuber cinereum, okay, tuber cinereum and the pituitary stalk infundibulum, pituitary stalk. Then we have got the mammillary bodies. We have got the posterior perforated substance. And also tegmentum of midbrain. Now, done the lateral wall. If I talk about the lateral wall is having a curved sulcus, and this curved sulcus, which has been written in the image by the word HS. What does HS means? Hypothalamic sulcus. HS means hypothalamic sulcus. और ये hypothalamic sulcus is exactly extending. It is exactly extending from the interventricular foramen of Monro to that of cerebral aqueduct. It is extending from interventricular foramen of Monro to cerebral aqueduct, and laterally it is related to. We already know the lateral wall. We have got two important structures in the relations. We have got the thalamus and hypothalamus. So done with this, now it is important to know the choroid plexus formation. So we have already, so exactly, then we will, so exactly अगर हम recesses की बात हो, just you have to know the recesses. So अगर हम recesses की बात करते हो तो 5 important recesses are there in the third ventricle, और ये important recesses of third ventricle is, so we have got following important recesses. We have got infundibulum recesses, infundibular recesses. Okay, we have got chiasmatic optic recesses or chiasmatic recesses. Optic recesses, we have got anterior recesses. We have got suprapineal recesses. We have got pineal recesses. Now here, if I talk about infundibular recesses, it's a deep tunnel-like recesses into the infundibulum part. Optic recesses is an angular recesses above the optic chiasma. Anterior recesses is just a triangular recesses which is traversing in front of interventricular foramen of Monro. Suprapineal recesses is lying above the pineal gland, and inside the pineal gland traversing is a small recesses that is called as pineal recesses. अगर हम choroid plexus की बात करें, so let's talk about the choroid plexus. If we talk about the choroid plexus formation in case of third ventricle, which is exactly related in the roof, it is exactly formed by the choroidal, posterior, medial part of the posterior choroidal artery. So, it is formed by the medial posterior choroidal arteries, and the medial posterior choroidal artery is a branch of PCA, posterior cerebral artery. So done. Now the next topic is, and the last topic for the ventricles and the CSF is circulation, is we have to introduce ourselves to what is CSF and the circulation and formation of CSF. So agar CSF ki baat kare, so before that I just want everybody to note down, this is lateral ventricle, this is schematic, this is a section, cadaveric section of the sagittal section. Lateral ventricle, which is located below the corpus callosum, CC for corpus callosum, and it is communicating via interventricular foramen of Monro to the third ventricle. Then we have got a cerebral aqueduct which forms a communication with the third ventricle to that of the fourth ventricle. And then from the fourth ventricle, as we have already seen there in the roof of fourth ventricle, there is foramen of mesenchyme and foramen of Luschka, which will help the transmission of CSF from the ventricular system to the subarachnoid cistern. So we will talk about this. So cerebrospinal, what is cerebrospinal fluid? So if we talk about the composition, it is similar. It is very much similar to blood plasma. Okay, it is very much similar to blood plasma, or you can say interstitial fluid, and it is actually present where? It is present in the ventricular system of brain and that of subarachnoid cistern. It is present in subarachnoid space. So basically CSF is surrounding the central nervous system. Composition की बात करें तो if I am talking about the absorption and circulation, so we'll talk about that. Before that, composition is more or less similar to blood plasma. It contains exactly, अगर for example specific gravity की बात करें तो specific gravity is approximately 1005 to 1008. Inorganic, it all so it contains, if we talk about cerebrospinal fluid, it contains inorganic salts, it contains trace amount of glucose, it contains amount of protein, but it's please note down low protein than plasma. So the protein is slightly lower than the blood plasma, and also glucose content is half of that of plasma, blood plasma. Plasma say half content, and chloride is slightly more. So if we talk about chloride, so chlorides are slightly more. और अगर हम chloride की बात करें तो chloride is slightly more in CSF. But basically the composition is more or less similar to interstitial fluid or blood plasma. So done. Now it's important to know about the circulation of the CSF. So CSF amount has to be maintained by a proper circulation, and the formation of CSF and its transport through the ventricular system and the subarachnoid system, and the absorption of the CSF, which is also important role it plays. So CSF is mainly, so I just want to show you an image for it. So अगर हम CSF की बात करें तो mainly it is formed by the lateral ventricle choroid plexus, and from the lateral ventricle, so you can see this is the corpus callosum, and just below the corpus callosum there is a choroid plexus and of the lateral ventricle, which will lead to the formation of, so lateral ventricle choroid plexus will form the maximum amount of CSF from interventricular foramen of Monro. It reaches the third ventricle. So this is the third ventricular location. Here will be the location of lateral ventricle, and from here this is CC for corpus callosum, and from the third ventricle it will communicate via cerebral aqueduct to that of fourth ventricle. And in the fourth ventricle, you can see this is the outline of the fourth ventricle. There is lateral apertures and there is median apertures. It will reach the inferior aspect of the cerebrum, and then it will be reaching in the cerebromedullary cistern. It will reaching the cerebromedullary cistern, inferior aspect of the through tentorial notch to the inferior aspect of the cerebrum, and through the pulsation of artery surrounding, it will be proceeding to the supralateral aspect of cerebral hemisphere, and ultimately with the help of arachnoid villi granulation of superior sagittal sinus, which will help in maximum absorption of the CSF. So this is how the circulation and maintenance of CSF takes place. So please write on that. So maximum amount of CSF is formed by lateral ventricles of brain. Maximum amount of CSF is formed by lateral ventricles of brain. So you can just write CSF in lateral ventricle of brain. From here, it will communicate via interventricular foramen of Monro to that of third ventricle. And from the third ventricle, so here you can just write on the steps. This is first, this is second, this is third. So I will just use the next page, and from here, that is from third, that is third ventricle. It will via cerebral aqueduct, it will reach to its fourth location, that is fourth ventricle. To the fourth ventricle, and in the fourth ventricle there is foramen of mesenchyme and foramen of Luschka. FL for foramen of Luschka and FM for foramen of mesenchyme, and it will reach the cerebromedullary cistern. And from here, from the cerebromedullary cistern, it will reach the inferior surface. It will pass through the tentorial notch, and it will reach the inferior surface of cerebrum. Inferior cerebrum or surface of the cerebrum. And from here, so this is the 7th point. So, and from the inferior surface of cerebrum, it will reach the supralateral surface of CHS, means cerebral hemisphere, and after that the arachnoid granulations or arachnoid villi will absorb maximum amount of CSF from that of superior sagittal sinus. So maximum amount for the arachnoid granulations and arachnoid villi, the maximum amount of CSF is absorbed to superior sagittal sinus. So this is the most important route which I have explained. If you want, once again I will just tell you about the flow chart. Maximum amount of CSF is formed by lateral ventricle. Via interventricular foramen of Monro, it reaches the third ventricle. Via cerebral aqueduct, it reaches the fourth ventricle. From fourth ventricle, the roof, there are two apertures, two lateral Luschka, that is upper, there is foramen of Luschka, and one median foramen of mesenchyme. It will reach the cerebromedullary cistern, then it will traverse the tentorial notch, will reach the inferior surface of the cerebral hemisphere. Via pulsations of the artery surrounding, it will reach the supralateral aspect of the brain, and ultimately via arachnoid granulations and villi of superior sagittal sinus, maximum amount of CSF is absorbed. So this is the most common route. Other than that, CSF can also traverse from fourth ventricle to the central canal. It can go to the subarachnoid spaces around the coda equina of the spinal cord. So done. So this is the most important thing. Other than that, we have to know slight about the applied aspects. So if I talk about the applied aspects, there is one of the clinical, so one of the cases hydrocephalus. Okay, yes. If we are talking about So hydrocephalus means the amount of CSF increase. There can be an obstruction to the flow of CSF. So it is of two types. One is communicating and the other is non-communicating. So I am not going into much detail because I have already explained these 2 points when I was taking the session of meninges. So communicating hydrocephalus means there can be a defect in the absorption of CSF, like there is excessive production of CSF or there is abnormality in the absorption of CSF, or agar koi obstruction hai via the passes from the ventricles or like cerebral aqueduct, interventricular foramen of Monro, agar obstruction, that kind of hydrocephalus is more serious, is the obstructive or non-communicating type of hydrocephalus. Now the next thing is, so other than that, so the next thing is so types of hydrocephalus already done, and the next thing which I want everybody to understand is the Froen syndrome. So if I am talking about a Froen syndrome, in case of Froen syndrome, the other name of Froen syndrome is, it is also called as loculation syndrome. So actually this is happening because of block which is in the, so the reason is there is block in the vertebral canal. So there is a block in the vertebral canal, and because of the block in the vertebral canal, what happens? This will prevent the flow of CSF. This will prevent flow of the CSF passing below the obstruction, and this will, so exactly the fluid, the CSF fluid which is lying below the obstruction will have certain features. So exactly there is a block of vertebral canal preventing the CSF fluid passing the obstruction. So the features of the CSF fluid below this obstruction, अगर हम इस fluid की बात करें या features की बात करें, so the features will be, the fluid will appear in yellow color due to xanthochromia, and also it will coagulate. So protein amount, coagulation will be seen. So it the fluid lower to it, CSF will be having more of protein. It coagulates because of the protein increase. And also if there is a sudden increase in the intracranial venous pressure, that will be not that pressure is not transmitted below, or the flow of CSF is not so smooth below this obstruction. So that is the one point. Now I would like to solve few MCQs related to the topic. So let's solve. Already we have talked about the features of hydrocephalus in the previous session, like children's mein agar hota hai to large head hota hai, fontanelles are widely separated, then there is also dilated big scalp, and there is dilated scalp when the eyes are looking down like a setting sun. These are the features. Now the arachnoid villi responsible for cerebrospinal fluid absorption protrude mainly in which of the following sinuses? The options are, it protrude into the superior sagittal sinus, inferior sagittal sinus, straight sinus and transverse sinus. So if you remember, I have told you maximum amount of arachnoid villi is protruding in superior sagittal sinus, and that is the right answer. Next, the lateral ventricle is connected in the third ventricle. The lateral ventricle is connected to the third ventricle via which of the following communication? Foramen of Monro, foramen of Luschka, foramen of Mazzandai, or median foramen. So the right answer is interventricular foramen of Monro. So you can just pause and give me the right answer. Floor of fourth ventricle is containing all of the following except there is abducens nerve nucleus, there is facial nucleus, there is dorsal vagal nucleus or hypoglossal nucleus. So actually all of these structures are related but not the facial nucleus. The structure which is lying in the floor of fourth ventricle is facial colliculus, which is formed by the winding of the motor fibers of facial nerve around abducens nerve nucleus. So the right answer is facial nucleus. Pineal gland form floor of third ventricle, anterior wall, posterior wall of third ventricle, or roof of third ventricle. So just now I have explained that the pineal gland and posterior commissures all are structures related in the posterior wall of third ventricle. Anterior horn of third ventricle is closed anteriorly by, thalamus, septum pellucidum, lamina terminalis, or corpus callosum. So anterior horn of lateral ventricle, if you see, it is anteriorly related by the corpus callosum. So we have done with this. All the best. Keep studying. So I have completed this topic, and all the important aspect which has to be known to you is already discussed. So I hope the session is useful for you. So if you have got any doubt, you can just connect to me. I also want that you should solve as many as MCQs, and it will be easy for you to understand. You have to correlate with the images provided. All the best and keep studying. Thank you so much.